Okay. These are the people coming in. Can you get that phone for me?
Yes,
okay.
of course.
Thank you, dear. Yes.
Okay.
There we go. I think we are all set to go. From the heart of AJINORAH, we welcome each and everyone who is joining our live. On the very outset, I would like to introduce ourselves. My name is Vipin and with me,
I am Meera Krishnan.
okay, we are here to present a beautiful module by name Speaking. It's an interesting module which both of us like. Yeah, okay. And mainly the topic that we have chosen was like how to introduce or how to begin our role play.
Yes,
Okay,
of course.
our students do have confusion with regard to in different settings how to start and how to proceed, etc. So we thought of starting up with that one. So, yeah.
Yes, of course. As I said, just we're going to give you thoughts regarding how to initiate role play, and it's very familiar to our OET candidates that they need to kind of put up their own self on a role play. Two different scenarios they will be given on their test day, and they have to present it in a proper manner. And I think, sir, most of the students find it very difficult, kind to commence a role play, right?
Exactly.
But it's very imperative that they need to give it in a proper and felicitous manner.
Exactly.
Yes.
So we thought of giving you something like if it is a race,
Yes.
it all depends upon how you start that
Yes,
race.
of course.
So those who get a good start, they will finish it up in a good manner. They will have a success story to say.
Yes.
So it's all depends upon how you start and or how you begin. Okay.
Yes, of
So we thought of it all depends on how you start. So we
Yes.
thought of doing it this live. Hopefully this will be beneficial. Don't
Yes.
consider this just as a program or a live that we are conducting, but consider this as a please do have your notebook and your pen with you. So please take down the notes. We will be presenting different scenarios which is available in OET settings. So you can take down the notes or you can note down how to start. Is that
Yes, of course. Of course, as I said, please try to take it as account that you're getting a class on speaking module. This is not just a live. You should get into the notes and you can use it later on your preparations, right?
Okay, you are right. You are right.
Yes.
Okay, fine. I hope things are set on track
Yes,
for us to go.
I hope that everybody is joining.
Okay.
Yes, hello Neetu ma'am. Good morning. Good morning Fessi ma'am. Good morning Ashwati.
Yeah.
Um,
Cordially welcome each and everyone who
Yes.
is coming over. Yeah. Okay, so before moving into the topic that we have just said, we would like to just tell you a good news.
Yes.
AJINORAH has become NSDC official sending organization. That is a great news for each and everyone who is associated with AJINORAH and those who wish to fly towards
yes,
Japan.
of course.
Okay.
Please try to make use of this opportunity.
Okay, legally we have become the official training partner with NSDC, that is National Skill Development Corporation. We are unifying with the central government to sending skilled and unskilled workers towards Japan, and we are unifying with them for this big event.
Yes.
Okay, and there will be a good news for each and every one.
Yes, this will be a great opportunity for the aspirants who are really wanting to go to Japan.
Okay, this is a new trend that is coming up. Please indulge into it as early as possible. Okay, we
Yes.
all welcome you for that. Okay, fine, that sounds great. So what do we have?
Yes, sir. So today we'll be, as I've already mentioned,
Yeah.
today we'll be discussing with the OET candidates that how they will be getting an OET case note
Yeah.
and what will be the different settings and how the possible ways of initiating each of the settings and role plays.
Okay.
Okay, so I hope that we can move forward to that.
Yeah, we can.
guess.
Okay, we are going to move forward. First and foremost, we have a role play, and the setting says what, ma'am?
Yes. Let me read the OET case note for you. The first thing which you want to look into a case note is the profession of yours, whether it is a nurse's OET case note. And the second thing is a setting. And the third one is the background of your OET role play and the task which you're going to undergo. So here I would like to explain that.
Please, you may.
Here the task is for nurse and the setting is a hospital surgical ward. Okay, so now I'll be moving on to the background. So it's like this. You have been nursing an elderly patient who had hip replacement surgery 3 days ago.
Okay.
And the surgeon has seen the patient today and has arranged for them to be discharged tomorrow.
Okay.
So you've been asked to discuss the discharge plan with the patient.
Okay.
I hope sir can elaborate a bit more.
Elaborate upon. So the thing is, at the setting, first and foremost, as ma'am said, when you get a role play card in your hand, what do you have to? Your eye must fall on the setting. What kind of setting it is. Once you know the setting, you can, almost 75% you can confirm whether it is a known case or unknown case, as we always say in each and every life that we conduct. So in this scenario, what ma'am just read, the setting says that hospital surgical ward. That means the patient is known to them. That means it is a known case because he underwent a hip replacement surgery 3 days ago. They are having his details in their hand, so it's a known case. So to explain this task, it goes hip replacement. He underwent hip replacement surgery 3 days ago, and the nurse is approaching this patient, at the advice of surgeon, to let the patient know about his discharge plan. Okay.
Yes, of course.
That is what the task says.
Yes,
okay.
sir.
So we will have a demo on how the candidates can start this conversation.
Okay, so before that, I would like to tell one more thing. Since it's a known case, it's very imperative that the candidates need to ask the name of the patient before starting the role play in the 3 minutes of preparation time.
Exactly.
Okay, so how may I address you during the role play?
Okay, you may address me with my first name, John.
Okay, okay, fine. So let me start.
Okay, you may.
Okay. So good morning, John.
Very good morning to you.
Okay, so let me introduce you once more. I'm Meera, one of the registered nurses working in this hospital surgical ward.
Okay.
I hope you are recovering well from the surgery, right?
Yep, as you have said, I just had a shower my own after long.
Okay.
I just had a shower my own. I'm getting better.
Yeah, that's very good to hear. And as you know that the doctor has advised you for your discharge tomorrow, so I'm here to give you an explanation regarding your discharge plan. So how does that sound?
That is not sounding so not good to me. I'm quite reluctant to go home as early. I was thinking about being in the hospital for quite more days and get well soon and getting back to my home. So I feel that this is quite early. I see the risks of being at home alone.
Oh, John, I can really sense your feeling because being in the home alone, doing your things by yourself would be very difficult since you have underwent the surgery recently. But please try not to worry. We'll give you all the assistance and explanations regarding that.
Okay, there we cut. We are not continuing with the continued task, but we were speaking about the initiation part of the speaking.
Yes.
So as ma'am explained, ma'am knows the name. She asked me the name during that 3 minutes of preparation. She asked me the name, so I said you can address me with my first name. She knows the name now. So as she started, she explained it as a doctor informed you. I'm here to explain the discharge plan and in detail. So the patient was bit reluctant or something. It's like he's not satisfied with being at home alone or something. So that's how the role play continues. When she started, it was very evident that at the advice of doctor, she is here to explain the things that is supposed to be known by the patient.
Yes, and it's very important that the nurse need to acknowledge the feelings of the patient. Since the patient was telling that he's reluctant to go home and do by his own activities, the nurse should acknowledge what the patient feels. That's very important.
Okay. Basically, what she said was she was getting into the shoes of the patient and understanding what a mental state he or she was. Okay. In this case, it was he. So another thing, as it came by gender, calling the patient on the correct gender is so important.
Yes,
if you just call a female by name of John or he, there you loses your mark and your grade can come down. Okay.
Yeah, of course.
Okay, fine. So I think we have some good mornings for both of us. Yes. Thank you. Okay, good morning, Archana. Reshma. Yes. Okay.
Good morning, Midun.
Okay. If the patient is a child, is it mandatory to ask the patient name with the attender.
Okay,
So,
that depends on the case notes,
Yeah.
right? If the patient is not present or we are not, that's not, it's not mandatory. It's just according to the name of the patient.
Okay.
Just like if it's in a surgical ward, for example, it's in a pediatric ward, when the patient is a 3-year-old boy is admitted and you're talking to the mother of the patient, it's important that you ask the name of the patient.
Okay.
So that you can just start like, if it's a patient's name is like Abraham, you can just start it like that. Good morning. Am I talking to Abraham's mother, or am I Abraham's parent?
Okay.
Likewise, you can start. So it depends on the case notes.
Okay, that doubt was posted by A.B. Verghese, and I hope we clarified that route. Okay.
Yes.
Okay, please explain regarding reassurance. Okay, we will be explaining towards the end about the reassurance
Yes,
points
of
that you
course.
can state upon. Please do stay tuned for that. Okay. I think without further ado, we can move to the next task.
Yes, sir.
And the setting says, I'll read out the setting for you. The nurse's setting, I'll read out the nurse's setting. The nurse's setting says emergency department of a large city hospital. It has a relevance. The nursing setting says emergency department of a large city hospital. I'll tell you why this large city hospital is mentioned over there as come by, or ma'am will explain to you.
Yes.
I'll just read out for you. Okay, a 32-year-old vehicle accident victim. The driver of the vehicle has been brought to the emergency suffering and suspected broken arm and concussion from the accident. The patient also appears moderately drunk. Okay, it is midnight on a Saturday night, and the ward doctors are very busy attending to many other patients, including victims of a vehicle accidents, bashing and drug overdoses. You are trying to assess the patient's injury before further treatment. It has a lot of complication and it has a lot of things in between coming by. So ma'am will explain to us how this task is.
Of course, sir. As sir has told, there are a lot of things to look in this particular background. Since we've taught the students that they need to wish the patient or the relative by the time they are talking to the patient or the relative. But in this case note, it is specified that it is a midnight on a Saturday night. So it's very important that you wish the wish the patient or the relative on a good morning, because it's a midnight. It's given that. So it's very important that the students need to identify if there is any specification of time on the role play card. You need to do as so. Okay, so let me explain this for you. So this is an emergency department of a large city hospital. So a lot of the students find it kind that when they see emergency department, they think that it's all a unknown case. But please try not to think like that, because you can confirm it only after reading the background and your first task, right?
Exactly.
Yes. Okay, so let me explain this for you. This task says that it's a 32-year-old vehicle accident victim, and he has been met with an accident, has been brought to the hospital, and is waiting for a consultation with the doctor.
That's
right. And he was been waiting for a long period of time since the emergency department is busy, since has told that it's a large city hospital where the relevance comes. It has a lot of patients to look after, and everybody is kind of busy with their work. So the patient has been waiting for a long time, right?
Yeah, that's right. I don't know whether you have noticed or not. When I was reading it, there was a statement which goes this way. Okay, the doctors were very busy attending to many other patients, including victims of vehicle accidents. This was a massive accident that happened. Not only your patient, there were others who got accident at the same time with the same vehicle. So the doctors were busy with maybe higher injuries.
Okay,
they were
prioritizing their care. But being a patient, they are more giving relevance to their care. Their right is that we cannot blame them,
right? That's right.
So here the patient is a bit reluctant to receive the care.
That's right.
That's why nurse need to be a kind of convincing to the patient while she is talking. So can we go to the role play?
We can go. Before that, there is another clause. He is moderately drunk. Okay, that's also another cause. He is not in his full consciousness. So that part also must be noted. That's why I said there are a lot of things to be noted in this role play card. In the setting which goes emergency department of a large city hospital, we shall see a demo on how to start this role play.
Okay. So good morning.
Very good morning to you.
Yes. Can you please help me with your name?
Okay, you can address me as Wilson.
Okay, Wilson. I'm really sorry. I apologize for you being waiting here for a long period of time.
Okay.
I'm Meera,
Okay.
and I'm a registered nurse working in this emergency department.
Yeah.
So it seems that you've been in an accident. So can you please brief me about that?
At present, I don't want to explain any of this. I would like to know where are my friends and others are. I just remember the yelling of my friends. I would like to know where my friends are and what happened to them exactly. All that I remember is the accident.
Yeah, I can really understand that. It will be a very dreadful situation for you to undergo. But please try to understand, give importance to your health first, following which I'll be able to give you the details of your friends.
I think you are not understanding what I am explaining to you. Please hand over my phone to me. I would like to make a call to my friends.
Yes, of course, that's a very reasonable concern from your side, Abraham.
Okay.
But please, at this moment, try to be calm, and I'll go and make the necessary arrangements so that we can make your prior care to you.
Can I just go to the chapel and pray for my friends? Can I make that?
Yes, of course you can do that. That's your very right to go into a chapel and pray for your friends. But I'll make an arrangement following your initiation of care. So will that be okay?
Yeah, that's fine. Okay, there we make a cut. So if you understand how this role play was going, so there was no chronological order to the questions that I was asking to the nurse, or what the concerns that I was saying. First, I asked, I would like to know about my patients. The second thing I asked was, please may I check my phone or make a call to my friends. Third thing I asked was, I was not answering to her question. The third one was, can I go to the chapel and pray for my friends? So there was no chronological order. There was no coherence existing. He was mildly drunk. That's why I said there is a close on that. Okay, I hope you got that. If you have any doubts or clarification with regard to this setting that we present, the second setting that we presented, please do comment below. We will be answering to your questions that you are asking. Okay.
So is there any questions, sir?
Okay. I think in YouTube we do have a few questions coming up.
Yes.
Okay. I'd like to ask you that if the patient is non-case, does needed to ask name again? Okay, I want to ask that. Okay, Swadi Krishna posted a doubt which goes this way. I want to ask you that if the patient is non-case, does need to ask name again? She's asking if it is a non-case, should we ask the name once again?
Once you start the role play.
Yeah, exactly.
Yeah, there is no need of asking this name again.
Yeah.
Once on your 3 minutes preparation of time, you should ask the name. And once you begin, you can just start it like, good morning, Vipin.
Yeah, good morning
like
to you.
that.
Yeah. That's how it is. Another JK Mohit is asking another doubt. If it is emergency department unknown case, when we need to ask the name first, concern or name?
Okay, so it depends upon the emergency of the situation. If it's a very emergency situation that you need to give the care so fast, it's important that you ask the concern first. But if you are going to assess the patient injury or you're going to give care to your patient, it's very not serious, then you can just go with the name and then you can ask the concern.
Okay, that's how I hope we cleared 2 doubts. If you have more doubts, please do comment below either in Facebook or in YouTube. We are streaming this live in both in Facebook of official page of AJINORAH and the official YouTube channel of AJINORAH. If you have any doubts or concerns, if you want to make any concerns or clarifications, doubts, please do post it below. We'll be clarifying it as and when the time allows.
Yes.
Okay. I don't think there is any doubt with regard to the emergency department of a large city hospital that we have just presented now. I think how we can okay, let me have a check of time. Okay, it's 11:47. I think we can move to the third role play.
Yes, of course.
Okay, which I can explain and you can
I'll read. Yeah.
Fine.
Okay, so I'll go with the reading.
Please.
So the setting is a maternal and child welfare clinic, and the background goes like this. You are a maternal and child welfare nurse. A young mother has brought her first child, an 18-month-old son Jack, to see you. Jack has always been a very contented baby, but during the last few days he has been quite fretful and crying. His mother is worried.
Okay, so this is a simple task. It is in maternal and child welfare clinic. This is a non-case or unknown case?
This is an unknown case.
This is an unknown case. Child is unknown to the medical nurse. Okay, fine. So which goes this way: you are a maternal and child welfare nurse. Okay, and the young mother has brought his first child, an 18-month-old son, Jack. Why I read this again? There was a name, Jack, that is important. You are talking to the mom, but there is a name mentioned of the child which is 18-month-old. That is relevant over there. Jack has always been very contented baby, but during the last few days, he has been quiet, fretful and crying. I hope you know the meaning of fretful. Fretful means reluctant or
being irritated.
Feeling an uneasy feeling. Okay, I hope you got that. Okay. The child, the Jack, is always a contented baby. For a few days, he is showing a perplexity, or fretful or crying, an unusual thing. That's why the mother is worried. And it is clearly mentioned, the child is the first one to this mom. So really, she can be confused or concerned. Okay, fine. So how can we proceed with this?
Of course, as we've previously said, it's an unknown case, and it's the baby or the mother is not familiar to the nurse. So we can present it as an unknown case.
Okay, fine.
Shall we start?
Yeah, we can.
Okay, so good morning.
Very good morning to you.
I'm Meera, one of the registered nurses working in this maternal and child welfare clinic.
Okay.
And I'll be assisting you today.
Sure.
So I can see a baby with you. Okay, can you please tell me the reason behind your visit?
Okay, my baby is very often, calm and quiet, and there is no much disturbance made to me or nothing. But, for quite a long time, or for past 2 or 3 days, he is showing an uneasiness. Okay, my baby Jack is feeling very uneasy and crying very badly. So I thought of consulting with a doctor, so I brought my child to the maternal and child welfare clinic.
Yes, okay, I can really understand. So can you please tell me your name?
Okay, my name is Meera.
Okay, Meera, so I can really understand, and since being a mother, it would be a very difficult situation for you to see your child in this condition.
Okay.
But please try not to worry. We have a good panel of nurses and doctors here who can help you in your all concerns.
Okay, fine. Okay. So this is how we start. It's a simple task. There is no much complication.
Yes, sir. But one more thing I would just want to add is here. He said that his mother is worried. When the mother's expression or facial expression or feelings is given, you can also start it like it seems that you're a bit worried. Can you please tell me the reason behind that?
Okay. Please note that at the beginning I told you, please have a book and a pen in your hand. Please do note that the expression or the mental state of the patient that is approaching is very important in OET role play. A patient who is very agitated, you cannot go and ask something like, "Are you okay?" or something.
Yes, you can understand it by seeing them.
Please do state their emotion first. From your facial expression, I can understand that you are a bit worried. Please may I know the reason behind it. So being a polite approach to the patient or patient's bystander would be very convenient for your OET examination and in real life as well, I hope. Okay, fine. So is there anything else you want to communicate with regard to the task that we have just done?
No, we have done it all.
We have done it all. Okay, I think if you have any doubts or clarifications to be needed with regard to the task that we presented or we started just now. Okay, difficulty for 3 minutes preparation intensely, can't understand. Okay, what's that?
Difficulty for 3-minute preparation initially. Can't understand.
Okay, we did not get your question. If you can post it or if you can frame that question once again, we can answer to the question that you have asked. Do you want to read through this?
During the preparation time, if you forget to ask name of the patient for non-case to wait. Okay, so that's a very relevant question. The question is just like this: if you forget to ask the name of the patient or even the relative during the 3 minutes of preparation time, how can we just quick start it? So that's one thing which you should very be sure about, that you should ask the name in the 3 minutes preparation time itself. But for instances, if you forget, you can just ask them like this. I'm Meera, one of the registered nurses working in this hospital ward. So can you please restate your name for the confirmation purpose? Or you can, or for the confirmation purpose, can you please restate your name? Likewise, you can ask. Please always make sure that you ask the name on the 3 minutes of preparation time. time itself.
Okay, fine. Basically, what she said was, if you forget, that's completely fine. OET is assessing the capacity of your English, not how you forgot or where you forgot. It doesn't matter. It's whether you have asked. Okay, okay, fine. We do have one more doubt by Santra. Is there any necessary to present in the exact order of the card task?
And any problem if we couldn't complete it. Okay. So, can I tell?
Yeah, please go for it. Go for it.
Okay. So, if we are following the order, it would be good. But if the patient asks a concern which is not appropriate to our order, please try to address that concern first, then go back to your task, because we all know that the nurse gives priority to the patients. So that's why please try to follow the same pattern. But if the patient asks a concern, address that first, then come back to your task, and there is no problem of not completing the task. If you are not completing it also is fine, but please try to complete it.
Yeah, basically Santra, as Santosh asked, was should be follow a chronological order as it is given. The bulletin point should be go by. If the patient is speaking about that, when you are discussing the first bulletin point and the patient is jumping to the fourth bulletin point or the third bulletin point asking regarding to that, please address that first, and you can come back to the second one later, or the as a next one you can come back as a second task. Okay, that's completely fine. Never that will reduce your mark or your, it will not bring down your grade.
Yes, of course.
I think we can move to the fourth task. I hope you are getting it.
Yes.
Okay, we have a beautiful setting. That is home visit. Okay, a very common in OET circle. We do have a home visit coming up. People do come, they imagine themselves, they are coming and standing in front of the door, calling, is it Santosh house, can I come in, please take your seats.
Yes,
a lot of things comes in. Okay, fine, we'll clarify all that as we move to. I'll just read out this task for you. Please do pay attention to it. Okay, you are a community nurse visiting an 80-year-old client, okay, who has lived alone fairly independently for a number of years in a granny flat beside his or her son's house on a rural property. The client's son's family is going to live overseas for 1 year, and to avoid being isolated while they are away, the client is going into a retirement home.
Yes.
You are conducting an aged care assessment for admission.
Yes.
Okay, as I have explained, this is a home visit. We are going to meet granny. Okay, one who is living in a granny flat alone, 80-year-old client. Okay, who is living independently, and the sons and daughters have moved towards overseas, and he is planning to move to where? Aged care home. Could you elaborate upon?
Okay, so since sir have read this background for you, you must be kind of understood about what exactly is going to happen in the role play. So let me explain this. A home visit is a non-case or a non-case, sir?
This is a non-case, right?
Yes, because the nurse know that where they are going and to whom they are talking to.
Correct.
Right. So in the 3 minutes of preparation time, it's very essential that you ask the name before you start the role play.
Correct.
Right. Okay. And here, as an 80-year-old client is living alone, but he or she have their son living nearby.
Okay.
But now what has happened is that the son is moving abroad.
Exactly.
Okay. So to prevent of being isolated, we are shifting our shifting our patient to a retirement home.
Correct.
So that's why the nurse has arrived at the home of the patient in order to get an aged care assessment done, so that they can take an admission for him to the retirement home. Right?
I think we are on the track. We can move on.
Okay, so can we do the role play?
Why? We can
okay, so how may I address you?
Okay, you may address me with the name Santosh.
Okay,
oh, sorry, Sandra. It's can be a either. Okay, what about Sandra?
Fine. Okay, so good morning, Sandra.
Good morning to you.
Okay, so I'm Meera, one of the registered nurses working in the nearest community health center.
Okay.
So, is this the right time to talk to you?
I think yes.
Yes. So I'm here to do an aged care assessment so that I can get an admission for you to at the retirement home once your son leaves abroad. So is that okay with you?
I think we can, I'm pleasant and yeah, I can move on.
Okay.
Yeah.
we can just start like this, or you can just start it like, am I talking to Sandra?
Yeah, you are talking to Sandra.
Okay, so like that you can start just by asking this single question, or you can just ask like, is this Sandra's house? Am I talking to the right person?
Okay, you are talking to Sandra.
Then you can go into the purpose.
Okay, correct.
Okay, so shall we display it once again?
Yeah, we will.
Okay, so is this Sandra's home?
Yes, it is.
Yeah, am I talking to the right person?
You are talking.
Okay, so today I'm here to do an assessment, and I am one of the registered nurses working in the community health center, and my name is Meera.
Okay.
Okay, so I'm here to do an aged care assessment. Since your son is moving abroad, they are asking you to shift to a retirement home. So will that be fine?
With regard to the plan, I'm completely okay. I'll be alone here once my son moves to abroad, but I have bit concerns about moving towards this old age home or aged care home.
Yeah, of course, Sandra. It's your right to get right kind of information from our side, and we are obliged to do that.
Okay, fine.
Okay.
Okay, this is how we move on. Okay, she will be asking some doubts with regard to her privacy and whether she will get all the necessary facilities. So the conversation moves on. So at the beginning, what she was explaining, you are asking a few questions you have asked. Please do write down in your notes. Can you just
of course, you can initially ask them that, is this Sandra's house?
Okay, is this Sandra's house? We are confirming whether we are in the right place. Okay.
And then we can ask that, am I talking to the right person?
Okay, you may be talking to another lady, okay, maybe housemaid. So we are confirming whether we are speaking to the correct person. Okay.
Then you can just state your purpose, and then you can just ask them that, is this the right time to do that?
Okay.
That will be fine.
Okay, we are good to go. Please do state your doubts with regard to home visit. If you have some doubt, we do have certain doubts, a lot of doubts. Okay, fine. How can we speak to a reluctant patient and convince them? Okay.
Where? How can we speak to a reluctant patient and convince them? Okay, so we can talk to them in a very polite manner, understanding their perspectives. We can tell them that, I can really sense your feeling at this point, but please try to understand that. I've got an example for that also. A person who really want to get discharged from the hospital, so because their spouse is alone in home, he is blind, so that the patient really wants to get back to the home. He's reluctant to be in this hospital. So being a nurse, you can convince them like this. If the patient's name is Sandra, you can tell them that, Sandra, I can really sense your feeling that making your husband alone in your house will be very difficult for you, since he is blind, or he is having the condition which you've mentioned. He cannot do everything by his own, but please try to understand your health is also equally important as your husband's health. Once you are healthy only, you can take care of your husband. So please don't worry, I'll make the necessary arrangements, or I can arrange a social worker in order to take care of your husband at home. And once you are okay, you'll be soon getting back to your house. So you can, likewise, you can convince a patient.
I hope you got that. I was not into that. That's why I'm not explaining anything on. Please note this down. Is it fine to use this?
Yeah, fine.
Okay. Okay.
Yes, that can be used.
Okay, fine. Okay, we do have another doubts coming in. Could you please explain some sign pausing words? Okay, sign pausing words are between one sentence and the other sentence, people do make some noises like okay, all these sounds comes in instead of a word. So basically this doubt is that instead of making this sound, can you pose some fillers or posing words, as I was telling you furthermore, in fact, perhaps, all these things can be used. Okay, fine. So I hope that is clear. Okay, fine. During a home visit, what we do if the patient is not cooperating, how do we convince?
Yeah, there is nothing like a home visit. It's similar to every scenario.
Yeah, correct.
When the patient is reluctant, the nurse need to emphasize that why this care is so important to the patient at that point. So why it is becoming that important. So once the patient get to know that it's so important for me to go to that treatment, the patient will automatically get convinced. So in any situation, the nurse need to focus on providing the information that the patient really wants.
Okay, fine. There was another doubt which is asked by Sandra P. Santosh. Could you please explain about the school health nurse situation and how we can handle and address the children? We have something special. The last role play that we will be saying or we will be doing it will be about a school care setting, which is rarest in OET.
And students find it difficult, to deal with the children because they have been doing a lot with adults, and it will be difficult for them.
Yeah, correct.
Yes, we will be doing it that for you.
Okay, there are a lot of clues inside. We cannot speak to a child as we speak to an adult, right?
Yes, of course.
So there is a clues. I think we are done with this.
Yes. So shall we move on to the next?
Yeah, I don't think you have doubts regard to home visit. Let's move to the other one, the fifth role play. And I can explain this, ma'am, if you can read that.
Yes. So here the nurse setting is a coronary care unit. Your patient is a 79-year-old who presented to the emergency last night with chest pain, nausea, vomiting. Okay, so an ECG and blood test showed evidence of mild myocardial infarction, and the cardiologist recommended an angiogram to be performed, but the patient feels anxious and unprepared. The attending cardiologist has asked you to explain the procedure and associated risks to the patient.
Okay, so as ma'am read, you must have heard what was the setting all about. The setting was coronary care unit. Okay, so the patient's age is mentioned on the very outset. Then the age of the patient is mentioned. He is 70. Okay, whatever the patient is, 79-year-old, and he is presented to emergency department last night and with the problem of chest pain, nausea, and vomiting. Okay, 3 symptoms have been mentioned over there: chest pain, nausea, and vomiting. Okay, so an ECG and blood test showed evidence of mild myocardial infarction. It is before that. It is clearly mentioned he was presented when last night.
Yes.
So it is a.
He was presented.
Okay, what case it is? It's a non-case. It's a non-case. Last night he was presented. So they must have taken the details.
Yes,
so it's a non-case. Okay, from that we must be able to understand that. Okay, fine. Okay, and the doctors diagnosed him with he had a mild myocardial infarction. Okay, fine. So the cardiologist recommended for what angiogram. The cardiologist recommended this particular patient for an angiogram, and the patient's the mindset in which mental state he or she is in is clearly mentioned. He is a bit anxious and unprepared for this angiogram. Okay. To this patient, with this mindset, the nurse is approaching the patient to tell the associated risks and the procedure, how the procedure goes, and the associated risks to explain. That's how it goes. Okay. Any doubts or clarification? Do you want to explain further on?
No, it's a good explanation. So I really want to have this role play done.
Okay, fine. We can.
Okay, since it's a known case, I would just ask you, how may I address during the role play?
Okay, you may address me with my first name, John.
Okay, John. Okay, fine. So let me start doing this.
Please.
Okay. Good morning, John.
Good morning to you.
Okay, let me remind you, I am Meera, one of the registered nurses working in this coronary care unit.
Okay.
I hope you're recovering well. Yes, I know that you're a bit anxious and unprepared for your procedure the doctor has advised you to undergo.
Exactly.
But please let me explain you a bit more about the procedure, if it's okay with you.
The thing is that when I heard this name, angiogram, I was a bit perplexed and a fear aroused in me what I am undergoing or what I am supposed to undergo in few hours. I have really concerns about it, how I will proceed and what are the things that I will come across during this procedure. So please, can you just continue telling me about the procedure and can you just convince me about that?
Yeah, I'm really glad that John, you are very willing to hear my advices, and it's quite natural that you will be having this kind of feeling since this is a novel experience for you.
Correct.
Okay, sir, I would like to give one more introduction for this. You can just start it like, as you know that the doctor has advised that you had a mild heart attack and you need to undergo an angiogram, I'll be here to explain you that. You can just say that like that also.
Okay,
as
fine.
you know that you have a mild heart attack
Okay.
and the doctor has advised you to undergo an angiogram.
Okay.
I would like to explain you more about that.
Okay, as it proceeds, a patient always says, I do not understand the procedure,
Yes.
whatever it is, you have to continue with that. Okay, that's how we moved by. So it was a clearly medically related
Yes, case
and
note.
also case note. It was really connected with medical, really associated with medical care angiogram. Do you have any doubts regard to that? I don't think this is an odd one, right? Very often I
Yeah.
have not found this in OET setting in being used. Okay. Okay, we do have some doubts, ma'am. What do we have exactly? The time limit, or we have finished it early?
Okay, so
Okay, this is a common concern. Everybody knows we have just 5 minutes, 3 minutes of preparation and 5 minutes of presentation. By chance, if we finish it by 4 minutes, we have 1 more minute. What will I do? I have done with my last bulletin point as well. Students do ask, what shall I do, sir? What shall I do? I am done with my role play at the tick of 4 minutes. So they are perplexed.
Yes,
Okay,
of course.
fine. So what we can do, once you have done with your role play, and if you come to know that you have still time left, if I am a student, I will just summarize everything once again for the patient by stating thus. I'll just say to the patient,
okay, can I add one thing
Please
in
go
that?
for it, go for
Okay,
it.
so once you just tell them that, like, let me summarize it, the patient may not be, kind of willing to hear that. So you can just tell them like this, to ensure that I haven't missed any important points,
Yeah.
let me summarize it once more to you.
okay, that was
So then the patient cannot, kind of ignore because it's their care.
correct. So you are summarizing it by saying, I'll just summarize it once again for you to ensure that I have not missed any points. So just summarize it point by point. Take the keywords and explain it. Never explain and exceed the time limit of 5 minutes. So please do keep in mind that and proceed it. It's absolutely okay. You can summarize it and you can conveniently finish it up in 5 minutes. Wrap it up in 5 minutes. Okay.
Understand.
Okay, simple display of role play card.
Okay,
Okay, fine. We will take that into consideration if you can. There was some technical error, so we couldn't display our role play card. We will be rectifying that in the next slide. I'm sorry for that. Okay.
Okay, so
Okay. Ma'am, can we use ER during the role play?
yeah, of course you can use. Yeah, we can introduce ourselves in the ED because it's quite rush likewise for a new patient.
I couldn't. No, Anita Paul, we did not get your question. Please do post it in a constructive manner so we can explain your doubt or we can clarify your doubts. Please make it once again. Okay. Okay, fine. I think there is nothing much left. I think we can move to the next role play, which is a 6th role play, and I shall read it for you.
Yes.
Okay. It's a simple task. Okay, very commonly students do learn it in their initial periods, right? Initial periods, foundation or orientation, they learn this. Okay, fine, I'll just read it out. The setting is community health center. Community health center is a common scenario that comes up in all the OET setting. Okay, you are a nurse practitioner at the community health center and run a support group for patients who wish to give up smoking.
Yes.
Okay, relevant. Your patient is a 40-year-old who is a new patient and has been smoking 20 cigarettes a day for past 25 years.
Yes.
Very relevant. So I'll just state keywords like your patient is you are running a supportive group.
Yes.
Okay, so now you are running a you have a supportive group, and the orientation or the goal of this group is that
Yes, so
smoking, give up smoking, cessation. Okay, fine. The patient is 40-year-old and a new patient came to you and he is smoking 20 cigarettes every day without a failure for past 25 years.
Yeah, so this is a task where we can understand that this is a unknown case.
Unknown case. That patient is not known to you, so it's unknown case.
Yes. So here we are a nurse practitioner, or the candidate will be acting as a nurse practitioner.
Yeah.
And the nurse practitioner is running a support group to help those who really want to quit smoking. And one patient is coming to you, and he's 40 years old and become a parent newly, and he want to quit this habit. So the nurse need to understand that how desperately he'll be wanting that, and the difficulty he may face, because it's been a long years, like 24 years means a long years. So it will be difficult for him to kind of quit it in an abrupt manner. So the nurse should take that into consideration when you are talking to the patient.
Correct.
Okay. So shall we move on to the role play?
Yeah, we can move, and we may do the first bulletin point as well. Okay,
fine.
Okay, we can move on.
Okay. So, good morning.
Good morning to you.
I'm Meera, one of the registered nurses working in this community health center.
Okay.
And I'm running a group for smoking cessation. So how can I help you in that?
Okay, I have been smoking for past 25 years without a failure. I've been smoking 20 cigarettes every day for past 25 years. So now I got a baby born. So I am a bit concerned about the health of my baby. As a result, I decided to quit smoking. So I'm here.
Okay, so can you please help me with your name?
Okay, my name is Blesson.
Okay, Blesson. And congratulations, first of all, to you becoming a father, and for your 40th birthday as well.
Thank you.
And I'm really glad that you took a good resolution at your 40th birthday to quit this smoking, and I can help you with everything you want.
Okay, thank you. Okay, fine. So this is how we go. Okay, in the first task it is mentioned he rolls his own cigarettes and make it, since the cigarette is quite expensive, and other things are mentioned. So we can tell all that, we can incorporate all that into it. It's a simple task. I don't think there will be,
because nurses may know about the hazards of smoking a cigarette.
Yeah, correct.
We can go with that.
Okay, and we saw ourselves video. Okay, ma'am, for an unknown case, we can ask both babies and mothers name during 3 minutes preparation time.
No, you can just, if I've already mentioned about the pediatric ward case, the patient is familiar to you.
Yeah.
So you can just ask the patient's name during the 3 minutes role play time, and then once you start, you can just ask them like, if I'm not wrong, you're Sandra's mother. Can you please tell me your name, or can you get your name, please? You can just start like that.
I hope you got what ma'am said. Ma'am was just saying, if it is in a pediatric ward, just ask. You may have the name of the child. You may address the mother as. I hope you are the mother.
Yes, if I'm not wrong, or I hope you are the parent of Sandra. So can you please help me with your name?
Okay.
That would be fine.
That would be better. Okay, fine. Anything else? Any other doubts, clarifications? Phrases for empathy, reason, do you want to say some phrases for empathy or something?
Yeah, you can tell like, I can really sense your feeling. I can really understand your situation. If I were you, I would have also responded like that.
Yeah.
Likewise, words you can take into account.
Feeling empathy means feeling for the patient. So
yes.
It's completely fine. You can just start by saying, I can understand your situation.
Yeah.
If I were in your shoes, I would have done the same. You may start this. Okay. Anything else? Community Health Center, we have done with the cigarette, and we are coming into the second last role play. Okay, the second last role play, and the setting which goes. I will explain this.
Yeah,
can you just read?
Fine. Yeah, that will be fine. Here the setting is a patient's home again. A home. You have come to do a blood test for a 77-year-old patient who had a serious stroke 6 months ago. You've just taken the blood sample and are now talking to his or her 76-year-old spouse, who is the main carer. The patient is not present for the discussion.
Okay, a lot of important points coming into this task. Okay, first and foremost, you have come to do a blood test for 77-year-old patient who had a serious stroke 6 months ago. Okay, it's understandable to me. The age is mentioned over there, but name is not mentioned. Okay, you have just taken the blood sample.
Yes.
It's a half of a sentence, but it has a lot of relevance in our role play. It will affect your mark. This sentence will affect your mark. You have just taken the blood sample. What does it mean?
You've just done a thing to the patient.
That means you were speaking this patient before, and you have done a procedure of collecting his blood sample, and middle of the conversation you are starting this role play.
Yes,
You understand? So if you draw a line linearly and something happened, this point to A point to B point, and you are starting the conversation at the B point and continuing to the C point. I hope you got it. This is the least thing that we can simplify it. Okay.
Yes.
A to B, you have done that. That is not part of our OET role play, and you are starting it from B point to C point. Hopefully that's clear.
Yes, of course, this is the middle of the conversation.
Yeah, that's right. Okay, fine. Any other thing? Okay, 76-year-old spouse. Okay,
so,
he's having a 76-year-old spouse as well, who is a main carer. She is taking care of this guy. Okay, the patient is not present for the discussion. That means the patient is not present for the discussion, but one who is caring, the spouse, is present for the discussion.
Yes, that is the thing need to be noted, because a lot of the students feel that they are talking to the patient itself. So you should be very careful and vigilant that you are understanding to whom you are talking to.
Right, you're right. Okay.
Okay, so
yeah. Are we good to go?
Yes, of course, we can do that. So you know that we are in between a conversation.
Yeah.
There is no need to introduce yourself once again, because you've been introduced yourself before the procedure.
Okay.
Okay. So can we start?
Yeah, we will.
Okay. So thank you for allowing me to take blood from your husband. Okay. So can you please tell me your name for better communication?
You may call me Preeta.
Okay, Preeta. So I know that you're a bit worried and anxious about your husband's condition. That's very quite natural. But as I've seen him, I can tell you that he is recovering in a very good manner, and he has a good progress.
Yeah, that is quite informative, and it is quite satisfying.
Yes.
I feel contented when you said that. At the same time, I would like to just tell you, it is quite difficult to take care of my spouse.
Yes.
Yeah, it's like carers come once a day to help washing and dressing, but I'm not doing almost everything else by myself. So as a woman working, I have to be the breadwinner now, so I have to take care of the family. In between the work, it's taking care of my husband is quite hard.
Yeah, I can really sense that you're being in a very hard situation. It will be very tough for you to go through.
Okay, fine. Okay, so that's how we started. So I hope you got how we start that setting.
So this is very important, setting and the type of role play which the students need to give a very good kind of concentration to understand that it's the middle of the conversation. We got a lot of kind of role plays like just examined. You've just started the intravenous fluids. So this means that you've been with the patient before. So you just want to start from there.
Okay. Basically, it is a non-case.
Yes.
It's a non-case. It's a non-case. If you have any doubts or clarification with regard to this patient, so it was quite difficult. So I explained with analogy. I hope you got that.
Yes. Here, what students may find is that why I asked your name, since it's a non-case. So this is a non-case because I know the patient. No, I am in contact with the patient. I may not be knowing the bystander's name. So that's why I just asked their name to convey.
She is conversing with the spouse or the bystander. She is very clearly it is mentioned the patient is not present over there. So please not any doubts, clarifications we can make. We can, it's a non-case, correct? Okay, daily buys, it's non-case, correct? Can you identify case in community health center and
so in the community health center or in urban clinic, you can identify it's a non-case or a non-case by just reading the background. If it's examined case, or if you've just started an IV fluids, or you've just taken a blood sample, you can consider it as a non-case, or you can just look into the first task. If it's confirmed, right? If it's confirmed, the reason for the visit, that may be a non-case.
Correct. Okay, that's how we find out. I hope we are coming to the last, role play card, which is the last one, right? Okay, we have some specification. We will be doing this role play entirely full. Okay, the complete thing we will be doing it. This is a difficult, but a different setting. There was a doubt in the comment box asking for a school nurse. Okay, a nurse is visiting school and meeting. It was quite, there was a doubt. This is a common doubt that is asked by our students. A school nurse going to the school and doing, I don't know how they go about it. Very seldom we get a role plays this one, but if it is in your hand, how can you proceed with get it. We will have a swim. Okay, fine. Okay, we'll get that. So,
Okay, so
towards the end, we can get that.
of
So, okay,
course.
fine. Yeah. We'll move to the last bullet. I'll read out. Okay. Now I am reading the patient task. Since we are doing the entire thing, I will just read out the patient task for everyone. So the setting is secondary school. It's a school setting, and the patient's task goes thus: you are Richard Gibson. Okay, Gibson. Okay. Richard Gibson, a grade 9 student in Hastings Secondary School. Your teachers have asked you to see the visiting school nurse as he thinks that you have put on more weight recently. You have been experiencing lethargy and he has been not interactive in class. Okay, so the thing is that basically it says the student is not just like other students. He's putting on weights. He's not attentive in the class. So there is a concern of a teacher. Please do meet the nurse who is visiting our school, the secondary school.
Of course.
Should I read the bulletin points?
Yeah.
Okay, the bulletin points also goes thus. Sorry about that. Okay, tell the nurse about your tiredness and difficulty in being attentive. So in the task itself, it was mentioned here the student is not attentive. The first bulletin point tells, tell the nurse about your tiredness and difficulty. The second bulletin point goes, ask for advice on reducing weight. He has put on drastically, he has put on the weight, so the teacher advised to meet the nurse, and he is seeking advice. Okay, second one, be willing to reduce fast food because it's what you enjoy eating. I would like to relish a lot of fast food which is prepared instantly. Okay, so unwilling to reduce. I am quite unwilling to reduce. I like that, so I don't want to make compromises on it. Okay, the fourth bulletin point goes, agree reluctantly to consume fruits and veggies, which I don't like. Exceptionally, I don't like fruits and veggies, but I like fast foods. Okay, I will agree upon. And the last bulletin point is, agree to monitor your weight and see the nurse again after a month. I am agreeing upon with the nurse after a discussion what I will monitor my weight as it is coming down after eating these fruits and veggies. Okay, I will meet this nurse after 1 month. Okay, this is the task of a patient. Now ma'am will tell us what the setting of this nurse's task is.
So here the setting, as I already have mentioned, at a secondary school, and the nurse task goes like this. You're the visiting school nurse at Hastings Secondary School, and you're seeing Richard Gibson, a grade 9 student who is obese. Okay, he does not participate in any physical activities at school or at home and consumes fast food and sugary beverages a lot. So he feels sleepy while attending the classes. So here it was given that he is obese, but this is a term which will make you confused. You are not allowed to use any judgmental words on the OET replace, so please try to keep that in mind. While you see this in the background, you may pronounce that, but please try to avoid those kind of words. Okay, can I move to the task?
Please.
Okay, so first task is like this: have his body mass index measured. The second task, ask about his lifestyle and routines. Then encourage him to take up any sport or other physical activities. Make him aware about healthy lifestyle choices and also warned of the long impact of too much junk food. And the last task is ask him to keep a tab of his weight every week and to see you a month later on your visit to the school.
So good to go.
Of course, since this is a school nurse and the name is also given, you can just address by the name itself. So can we start?
Please, you may.
Okay, so good morning, Richardson.
Good morning to you.
Okay, so had your breakfast?
Yes, I had a good breakfast, a heavy one.
Okay, that's good to hear. And do you know me?
I have seen you several times. You're visiting our home, but I never met you in person.
Okay, so I can help you with that. I'm Meera and I'm your school nurse. And can you please tell me that what you had for your breakfast?
I had few brownies and I had a good sweet item and a cup of coffee.
Okay, that's fine. And now can I get your permission to check your height and weight?
You may.
Yeah, thank you. So thank you, Richard, for allowing me to take your height and weight. And are you waiting to hear your results?
Yes, I am.
Okay, Richard, I know that it would be exciting to you, but I would like to tell you that since I've measured your height and weight, your weight is a bit more than expected, or it's not proportional to your height. But please try not to worry. I'll help you with that to reduce your weight. So how does that sound?
Oh, that sounds very bad to me. Okay, my height is not coping up with my weight,
Yes.
or my weight is not coping up with my height.
Yeah, but that's not your fault, Richard. Being your school nurse, I will be, kind of responsible for your health, and I'll be helping you out with that.
Okay.
Okay, so can you explain me about your routines, like the time at which you go to bed?
When I get back home after my classes, my mother will be preparing something. I'll have that sumptuous meal, and when I sit to do my homework, I feel so sleepy, and I get to bed so early, 8:30, and I'll get up in the morning 7:30 or something.
Okay, that's fine. Then you take this kind of what you've taken, brownies.
Yeah, brownies.
Right, and is that made in your home, or it's bought from outside?
No, my mother is not known to cook all this, so we get it from bakeries and outside stores.
Yes, I can really understand, Richard. The children in this age are, kind of more eagerly and more craving for this kind of foods. I'm not asking you to quit this habit, but can you please do me a favor if you don't mind?
Yes, you may
Yes,
ask.
I think that you love burgers and sandwiches, right?
Yes, I do.
Okay, so can you please ask your mom to cook it for you with some veggies inside it?
Veggies? I'm not in favor of veggies. I love non-veggies.
Yes.
I'm in favor of that.
Yes, I can really understand, Richard, but since I've mentioned you that I want you to make, fit in your future, and you want to look like a good, healthy person in the future like anyone else.
Okay.
So that's why I'm insisting you to do this. So will that be okay with you?
The statement that you have made is not so convincing for me, but since you are asking me to do that, I will try upon.
I'm really glad that you accepted and you'll try that.
Okay.
And you can take this kind of foods that is bought from the stores or kind of sugary foods. You can take it once or twice in a week so that you can get rid of your craving. So is that okay with you?
I think I can manage upon.
Can, because this is because I'm asking you to do this is because I've already mentioned you, Richard. You're a very good kid, and you need to be a very good adult as well.
Okay.
Right?
Okay.
Okay. So I've seen a lot of children playing in the playground when I come to the school. So are you participating in any of these activities?
You know that my soul says, and I humble myself, felt that I am a bit tired and I cannot be attentive in the playground or in the class, so I'm a bit lethargic. So if I go amongst them, they may not make me join for the games or something, so I don't belong there. That's a feeling that I get, so I sit aside.
Oh, I'm really sorry to hear that, Richard. But if you follow what the suggestions just have given before, you'll be able to participate in any of the games. So can I make an appointment with your sir so that you can get an admission for any of the sports that is provided by your school?
I think that sounds great for me.
Yeah, that will be good, and you'll get to have more sweats, and also you'll be able to get a competitive mind as well.
That's great.
Okay, so I want you to ask one more favor.
Yeah, please.
Okay, so I'll ask your teacher too, but please be cooperative to record your weight every week so that once I get to you in the next month, I can understand how you have improved.
Okay, I can cooperate for that.
Yeah, that's perfect. And Richard, do you have any concerns?
All that you said was comparatively convincing for me, so I'll agree upon to the things that I can do.
Okay, so that's perfectly fine, and please, I'm here always to help you. So if any doubts or clarifications needed regarding the food items or the kinds of activities that you need to do, you can always contact your teacher so that she can give information to me.
Sure.
Okay, thank you, Richard, and we can leave to your class.
Thank you, nurse.
Thank you.
Okay, this is how we have done our role play. So the patient was a patient, or the child, one who is studying in the 9th grade, was quite reluctant to agree upon the food that he was continuously taking, that is non-veg and the junk food and the fast food that he was getting. Now because of his lack of attentiveness and he is putting on weight drastically, the class teacher found that he need a medical help. So the regular visitor of the school, the nurse, is advising this guy to bring down to fruits and veggies, which is not in favor of his taste. So convincing a child, oh, this is how. So there was a calmness, a cuteness in her presentation. I don't know whether you have noticed or not. That is what we need when you deal with a secondary school child or a school child or in a school setup. You cannot talk to a child, one who is studying in 9th grade, like an adult. He is not matured enough to understand.
Yeah, here's given that task about his lifestyle and routines.
Yeah.
When you ask them, can you please explain me about your lifestyle? Can the student understand or will be able to explain? No. And it's given that can you identify, encourage him to do physical activities? Can we tell him physical activities? He will not be able to understand.
Correct.
So that's why we are telling that any of the sports you can ask. You can also add that being a boy, it would be interesting you to involve in a cricket, football, basketball. That plays also.
Okay, that's how we present it. We simplify it from complexity. Okay.
Yes.
Finally, hop it.
This is a basic structure. You can make any changes.
You can make always. There is a road for a room for making amendments on this. This is a way that we can do it.
Yes, I focused on the way that you need to talk to the child.
Hopefully, students, we are on the same page. Okay, there was a doubt coming up. There was a doubt asked by whether they need some phrases, empathetic phrases that they can use in between the conversation. I think ma'am can say one or two or three or more.
Yes. Yep. You can ask, like when a patient is giving you any kind of information, you can acknowledge them by saying that you are making total sense to me.
Okay.
You can say that. Okay, then you can say that I would feel the same way you do in your situation.
Okay.
And you can say that, well, I agree with most of what you are saying. Then I can understand how that would be difficult for you.
Okay.
And I can imagine what you must be going through.
Okay.
All this kind of words you can use for acknowledging.
You need not write everything. Write down, please, at least one or two, and please use it in your conversation when you go for daily practicing or speaking. Okay, daily conversation. Please do use it. These phrases, I can feel what you feel, or I can get the feeling that you are feeling right now. Okay. Okay. I'm on your same shoes. If I were in your shoes, I will feel the same. You can use all these. Okay. Any other doubts or clarifications?
Sir, I wanted to tell you one more thing.
Please.
That students always find it difficult. So since we've done a role play of just examined case, likewise we will be getting the first task as the background will be saying that you have just examined the patient, and now we are talking to the patient. So the first task will be like find out more details about that particular condition. Then the second point would be like confirm that the patient, for example, if the patient has a ringworm, the nurse have examined a rash on his calf.
Okay.
Now the first point is like find out more details about the rash.
Okay.
The second point would be like confirm the patient has a ringworm. Okay, so in this particular period of time, the students are always doing like, thank you for allowing me to examine you, and from my examination I found that you have ringworm infection. But exactly we need not to go like that.
Correct.
Because in the first task it is given that find out more details about the task.
So not yet found out. It's all about you are going to find out.
Yes, once you find out only you can say that from your explanation and from my assessment, I can tell you that you have a ringworm infection. So please keep it in mind.
Yeah. I think we have already done with our prepared notes. If you have any more doubts with regard to speaking or general doubts that you want to post upon, please do post. We will be answering to your questions. Thank you, sir and ma'am.
Is BMI already measured or not in first task? No, have his body mass index measured. That means you need to measure it.
Yeah,
that's why I asked Richard to, can I please measure your height and weight? You cannot tell them that like body mass index, right?
So complexity, please avoid the complexity and use it in a simple language where kids will understand, or an adult will, or a 9-year-old, 9th standard student will understand. Okay. Okay. Fine. Okay. I think we are done.
Yes.
We are done with all our things, and at the beginning I have told you something, a good news coming up from
Yes,
AJINORAH.
of
It
course.
was like AJINORAH was joining with NSDC, okay, National Skill Development Corporation, which is part of central government.
Yes.
We became the official training partner for NSDC. Okay.
Yeah, that's a very
And,
great opportunity, and I hope that everyone will use that opportunity in a correct manner.
Yeah, those who are flying towards Japan, those who wish to fly towards
Yes.
Japan, okay, we have become Japan sending organization,
Yes,
okay,
of
official sending organization along with the National Skill Development Corporation. I think we can utilize this opportunity for a better future or a brighter future. For more details, please do contact AJINORAH. The
Yes, of course.
number is what was that number all about? The number that we usually give is 888848 and 501234. Okay,
Yes.
888848 and 501234. Okay, I hope you got it.
Yes.
Any doubts or clarification, you can make contacts on this number. They will be giving you more details, or they will be telling you with regard to that.
Yes.
So I think we are done.
Yeah, we've done our duties and we've done the session, and
Okay. I
hope
hope
that
this-
we clarified the doubts as well.
I hope this session was so beneficial
Yes.
for you. Hope meet you all guys with another session
Yes,
on
of course.
another day.
Yeah.
Okay, thank you. I'm
Thank
signing
you.
off.
Thank
We've been
you.
Wilson.
I'm
And
Meera.
with it, thank you.
Thank you.